Namaste. I am Dr. Binu C. Nair, working at Pulikil Ayurveda Hospital, Peruva, Kottayam district, Kerala and India. Ayurveda. Ayurveda is the ancient system of Indian medicine which is practiced more than 5000 years. And now Ayurveda in modern era in India it's under the Ayush ministry. The first among which is Ayurveda itself. All the Indian medicinal systems comes under the control of Ayush ministry, and the ancient system of this practice, Ayurveda. The term means it consists of two words, Ayu and Veda. Ayu means lifespan and Veda means knowledge. It's actually the knowledge of lifespan. Ayurveda deals with two categories to maintain the health of a healthy person and curing the disease of a diseased person. Ayurveda definition of health itself is a holistic approach. It's defined as the equilibrium of body, mind and soul. And Ayurveda is that it's a knowledge evolved from centuries. And Ayurveda actually consists of the knowledge which is gained from the experiences. Then these knowledges are analyzed and it is processed, and all these knowledge in a scientific manner, these knowledges are written and they are documented. That same is passed traditionally earlier times in Gurukula method, where the knowledge was passed on to the disciples from a guru who is a teacher, who is an exponent, who is an experienced and veteran in this field. From each field, these disciples will gain the knowledge and start their practice of this medical system. Nowadays, this Ayurveda is included in the health universities in India, and these courses are run for 5.5 years along with the internship, and these degree holders are also doing the specialities in each of the field, where in Ayurveda the 8 angas or 8 disciplines are mentioned, which are general medicine, then pediatrics, surgery, then psychological diseases treatment, then above head means that is above neck, that is ENT and ophthalmology, then rejuvenation and geriatrics, and last is aphrodisiac. These treatments are practiced, and nowadays the departments are classified according to the modern methods, like each part are treated separately in Ayurvedic method. Then about our Pulikil Ayurveda Hospital is a traditional healing center in Ayurveda. Our location is Peruva, Kottayam district, Kerala in India. And the traditional practitioners adopt the traditional methods or traditional knowledges which are gained from their practices, along with that modern advancements and modern college education are also gained by the practitioners. At our hospital, we are having regular consultations, and there are panel discussions where or difficult or complicated cases are discussed. Then we are conducting medical camps, health checkups at various locations. These are the practicing methods. About the treatment methods, as an OP or consultation, we are having two types of treatments, that is internal medications, then second is purification or Shodhana or Panchakarma treatments, and third are Shastrakarma or surgical procedures and parasurgical procedures. The first one, internal medicine or general medicine we can say. These patients are given purely Ayurvedic medicines which are either herbal origin or herbo-mineral in origin. Then second type of treatment, which is Shodhana or purificatory treatments, they are elimination of impurities, you can say as a detox treatment, which are accumulated, these toxins which are accumulated in our body are eliminated through these 5 classical procedures or Shodhana treatments. The third is Shastra or surgical and parasurgical procedures. Even though the surgical procedures which are mentioned in Ayurveda and practiced in Ayurveda are not advanced due to many reasons, we are practicing these procedures which are most essential because that procedures are considered to be the last resort. So in such cases, these parasurgical procedures, which are also very helpful and very much easier in curing many of the skin ailments, are usually practiced in our hospital. Ayurveda in COVID-19 management. In COVID-19 prevention, treatment and rehabilitation, Ayurveda designed its own protocol, and this prevention activity in COVID-19 mainly aims at removing the impurities from the body, detoxification, then boosting the immunity, and third is environmental detoxification. And this prevention of COVID aims at all these 3 factors in prevention, and which consists of regular diet, exercises and usage of medicines, and environment cleansing or removing the pollutants from our surroundings. In Ayurvedic management of COVID-19, the medicines are given for mild and moderate cases of this COVID-19. Standalone Ayurveda treatments are very effective in reducing the viral load and relieving the symptoms as early as possible in those cases. Such patients were able to have a sequel-free life after COVID-19 curing. Then the third is severe cases of COVID-19, where along with the standard care, Ayurvedic treatments gave a problem-free or sequel-free or easier recovery in those severe cases. And coming to the rehabilitation of the third portion, post-COVID cases, there are multiple systems involved in this post-COVID, ranging from respiratory, cardiovascular, then musculoskeletal and psychological effects in the post-COVID. Ayurveda, each systems are dealt separately in all these symptoms, and with Ayurvedic treatments and rejuvenation methods, people are are capable of regaining their health in the post-COVID times, and the sequel or long COVID is easily cured with the Ayurvedic management. Thank you all.
Namaste, I am Dr. Santa K.S., working as a resident medical officer at Pulikal Ayurveda Hospital. I am mainly dealing with gynecological cases, and also I am the yoga instructor at this institution. Yoga is an ancient practice originated in India, which involves movement, meditation and breathing techniques to promote the physical, mental and social well-being. It has 8 divisions: Ashtanga Yoga, which consists of pranayama or breathing techniques, asanas or postures, dhyana or meditation, which are the most popular among these 8 divisions.